today?
I'm good. How are you?
I'm doing great. My name is Veronica. I'm a student at Advent Health University, and I'm here today to do a head-to-toe assessment on you. Is that okay for you?
Mm-hmm.
All right, wonderful. Could you please verify your name, last name, and date of birth for me, please?
Tiffany Kuling, 11/11/1998.
All right, wonderful. Very young. Have you experienced any pain so far?
No.
No. Have you drank, eat in the last previous 30 minutes?
No.
All right, wonderful. Are you able to follow my commands if I ask you to?
Yeah.
Okay. Do you know where you at?
Yeah. Advent Health Hospital.
Okay. Do you know what today it is?
December 2nd, 2020.
Wonderful. And what's the current president?
Donald Trump.
All right, great. Do you use any aid devices that help you to walk, such as walker or
No. I just have glasses.
glasses? Are they prescribed or aesthetical?
Prescribed.
Okay, wonderful. Okay. Based on what I see, my patient is sitting in an upright position. She seems calm and relaxed, appropriate to the situation. His skin color is consistent throughout the whole body. I don't see any signs of redness or swellings. No others were noticed. She seems well hydrated because she doesn't have any sunken eyes. She seems well nourished. Her speech was clear and understandable. My patient was able to repeat the 3 questions that I asked regarding time, place, and person. So my patient is oriented ×3. She don't use any AI health devices. Okay. And I don't see any involuntary movements, no dropping of the eyes. Wonderful. Okay, have you ever experienced any head pain or hurt your head
No.
recently? No? Okay, great. What I inspect is her skin color is consistent through the head. I don't see any signs of lesions or swellings or redness. I'm gonna get closer so I can help you and inspect your scalp, okay? All right. The scalp is without any lesions or masses. Okay, no ticks or signs of infections. Her hair is brown, curly. I'm gonna palpate. All right, the skull is without lumps or masses, and it's normal cephalic, and the head is proportional to the body. Okay, are you experiencing any pain in your face? No? Okay. As the same before, I didn't see any involuntary movements or ticks, and there is no dropping of the eyes, and the color is consistent throughout the whole body. Okay. I'm gonna go ahead and check for your temporal artery, okay? All right, pulsations of the temporal artery is 2+ on a 4-point scale, which is normal. Okay. Have you experienced any eye injuries in the past 6 months?
No.
No foraging body center to your ear sometimes? No? Okay. I'm gonna go ahead and check really quick. Okay. The eyebrows, I don't see any unexplained hair loss. The eyelids open and closes completely with a spontaneous blinking. The eyelashes are distributed throughout the whole lid of the margin of lids, and the lashes curves away from the body, from the eyes. Okay, I'm gonna do this in your eyes very quick. I'm supposed that I'm doing it. All right, the conjunctiva, it's clear, transparent with a little blood vessels visible. The sclera is wide and smooth with no vascularity noticed. The iris is dark brown, consistent color throughout the whole iris, and no signs of discoloration or lesions present. The pupil size, I'm gonna check very quick for like accommodation. Pupil size. All right, your pupil size were 4. Okay, and reacted to light. All right, and the cornea has a normal angle as well, and no deformities present. Okay, I'm gonna go ahead and check for light accommodation and corneal reflex. I need that you look at the bridge of your nose. Okay, I'm gonna shine some light on there. All right, light reflection is exactly on the same spot of the eyes on both sides. I'm gonna go ahead and check. I need that you stare at this pen light for near and far accommodation. All right, and now I need that you follow the pen, okay? All right. The patient was able to do far and near accommodations without deformities or involuntary movements. And my patient's eye moved, thank you, moved smoothly and symmetrical in both eyes around all fields of gaze. Okay, I'm gonna check for constrictions of your pupil through the light. Okay. All right, so the pupils are equal and round, reacted to light with accommodation and a positive consensual response. Okay. And now I'm gonna go ahead and check for your ears. Have you ever experienced any ear infection?
No.
None at all. Okay. I'm gonna go check it very quick. Right, the skin color of the ear is consistent through the face and neck. There's no signs of swelling or redness. Both of the ears are fully formed, symmetrical, and equal in size. I see some fine hairs around it. I'm gonna check for canal meatus. Okay, no exudations present and no infections noticed. Okay, I'm gonna go ahead and palpate your articles and tragus, and if you feel any pain, please let me know, okay? Okay, this is the article, tragus, no pains.
No, no pain.
Okay, the ears are firm without any lumps or masses and no tenderness. Now I'm going to do the whisper test, which consists, I need that you please close one of your ears. I'm going to whisper 3 words, and I need that you repeat me back, okay? All right.
439.
All right, wonderful. Other side.
Blue. Count 1.
Yes, wonderful. My patient was able to repeat the 3 exact words without any mistakes. Okay, now I'm gonna go ahead and check for your nose. Have you experienced any allergies, such as pollen allergies? No, all right. Okay, so what I see, the nose is in the midline and symmetrical to the face. No deformities noticed, no redness or swelling, no signs of infections neither, or bruises. Okay, I'm gonna go ahead for your nasal mucosa. All right, it's pink and moist. And also I'm gonna check for your patency of your nostrils. So I please that you close one of the nostrils and breathe for me. Okay, the other one. Great, do you have any problem breathing on each side? Okay, both of the nostrils are patent. Okay, now I'm gonna move to your mouth. Have you experienced any problem, swelling, yeah?
No, no swelling.
Okay, and when was the last time you went to the dentist's office?
The beginning of this year.
Okay, it was for cavities or regular checkup?
Regular.
Okay, wonderful. I need that you please open your mouth for me. Right now, my patient has a mask, but in a normal hospital setting, I will check and I put light on the mouth and check for the teeth. I will check for no teeth discoloration or cavities, as well as the gums, if there's any swelling or redness, or if there's a signs of gingivitis. I will check the vocal mucosa. It should be pink and moist. No signs of lesions or tumors or masses. And also, I will check for the tongue. The tongue is in the midline, smooth and pink. Okay, no signs of lesions on the tongue or any bumps or masses. And I need that you please do for me, please. All right, the uvula rises and falls symmetrically. That means the cranial nerves 9 and 10 are intact. Okay, now I'm gonna check for your neck. Have you experienced any neck injury or car accident?
No.
No, that is wonderful. All right, so based on what I see, I need that you please look forward a little bit so I can see. All right, I didn't see any signs of jugular distension or venous pulsations, no swelling or redness. All right, let me check very quick. All right, the trachea is in the midline. No lumps or masses visible. Okay. I'm gonna go ahead and check for your lymph nodes. Okay, I'm gonna touch you. This is pre-auricle, post-auricular, occipital, and then we go tonsillar, and then submandibular, and then submental, and going down, so superficial cervical, and then deep cervical chain. Okay, any pain?
No.
All right, wonderful. So there is no lumps or masses palpable, and lymph nodes were not palpable neither. Okay, I'm gonna go ahead and check for your thyroid gland. Have you ever been diagnosed with thyroid disease?
No.
Okay, I'm gonna go behind and check very quick. I push and I palpate, push and then palpate. No signs of thyroid gland enlargements. Okay, now we're gonna do some movements. I need that you move down to the floor for me, please. Okay, up, left, right. Okay, sorry, and shrink your shoulders. Wonderful. We're gonna repeat the same movements, but now I'm gonna put some resistance. Okay. All right, forward. Okay, back. Okay, left. Unfortunately, my video stopped in the middle of the video, so I'm gonna continue from where I left off. My patient was doing a full range of motions on the neck. I need that you turn to the right for me, please. Okay, now I need that you shrink your shoulders for me. Okay, now I'm gonna put some resistance to it. All right, my patient was able to move without discomfort or pain, and well movement of the neck, and it has a full range of motion on the neck. Now I'm gonna go ahead and check for your chest. Have you ever experienced any asthma or difficulty in
No.
breathing? Okay, based on what I see, this thoracic cavity is symmetrical on the anterior, lateral, and posterior as well. There's no signs of redness, swellings, pallor, or sinus color that indicates not proper breathing. Her color skin is consistent throughout the whole chest area. No signs of swelling or redness, no heave or leave. And I see that the patient is not using any it's not using any accessory muscles to help her to breathe. Okay, I'm gonna go ahead and apply some palpation. I need that you breathe when I tell you, okay? Can you please breathe? One more time. All right. The thoracic cavity expands symmetrically, anterior and laterally. I'm gonna go ahead and check same for thoracic expansion in the back. Can you do it for me? Okay, one more time. Great. The thoracic cavity expands exactly the same level, and my tongue separated about 5 centimeters. That means it's symmetrical, and the expansion in the posterior and lateral as well. Okay, I'm gonna go ahead and palpate, and if you feel any tenderness, please let me know. Okay. Right. This. Right, any tenderness? Okay, I'm gonna do the same thing in the back. All right, I didn't feel any lumps or masses or deformities while I was palpating. I'm gonna go ahead and put some touch you again in different parts, and every time I touch I need that you say 99 for me, okay?
99, 99, 99, 99, 99, 99.
Okay, let's make the back as well.
99, 99, 99, 99, 99.
All right, the tachyphrenitis is equal and symmetrical in the posterior, lateral, and anterior. Okay, I'm gonna percuss. right. The lungs are resonant. Now I'm gonna go ahead and auscultate. Every time I'm gonna put the stethoscope, I need that you breathe for me, please, deeply. But first, I'm gonna bring my stethoscope. And then warm it up a little bit. Okay, breathe. Back. Breathe. Okay. The particular breath sounds are without adventitious sounds. That means there were no bronchi, whistles, or crackles listened while I was listening to your lungs. Okay? Now I'm going to inspect your pericardium. Have you ever been diagnosed with a stroke or hypertension?
No.
No? Okay. I'm gonna, based on what I see, there is no signs of redness or swellings on the pericardium area. No pulsations are visible. Okay, I'm gonna go ahead and palpate for any pulsations. Okay. All right. There were no pulsations palpable on the pericardium, and I'm gonna check for your skin turgor for the last system. Okay, the skin turgor promptly recoils fast, which means a positive skin turgor. Okay, now I'm going to auscultate the apical pulse, which is located in the midclavicular line and the ferrous intercostal space. Okay, 30 seconds. Okay, wonderful. The heart rate and rhythm are regular, and the beats per minute of your heart at 78, which is in the normal range of 60 to 100 beats per minute. Now I'm going to go ahead and auscultate your pulse S1 and S2. Okay? Go in the second intercostal space on the right side. I will find the aortic valve. Okay. Pulmonic valve. Then the fourth intercostal space, I will find the tricuspid. Okay, and right on the next one. Okay, wonderful. I'm going to do the same thing with my other part, okay? There were no murmurs, dollops, or rubs, hearing when listening to your pulse. And S1, it was louder on the mitral and tricuspid area, and S2 was louder on the top of the heart, the base of the heart, which is aortic and pulmonic area. Okay. Now I'm gonna go ahead and check for your upper extremities. Have you ever have any fracture in your upper extremities? Any dislocation?
No.
None at all. Okay. I need that you please move your hands for me like that. Okay. Inspecting the lengths of the arms are equal. The arms are symmetrical in size. I don't see any signs of lesions or redness or swelling in any of those parts. And the size of each are the same. Okay. Temperature is warm at touch. Okay, I need that you move it like this. I'm gonna go ahead and check for your brachial and radial pulse. Okay, your brachial pulse is 2 pulse on a 4-point scale. Like this. Alright, and the radial pulse is 2 pulse on a 4-point scale. Okay, I'm gonna go ahead and check for capillary refill. At this moment, the patient has a glove, but in a hospital environment, I will check if the capillary refill is less than 3 seconds, which is normally expected. Okay. Okay, capillary refill is positive, returning blood in less than 3 seconds. Now I'm gonna do a test where you have to identify if what I'm touching is dull or sharp. Okay. And I need that you please close your eyes.
Sharp. Dull. Sharp. Sharp. Dull. Dull. Dull.
Okay. Now I'm going to do the same thing, but with something that is soft. And I need that you close your eyes, and every time you feel that I'm touching, you say yes, right? Okay?
Yes. 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 Yes.
Okay, wonderful. My patient was able to identify sharp, dull, and light of touch. That means the pain sensation is intact, and all the cranial nerves related to pain are working properly. Now we're gonna do some movement, so I need that you please stand up for me. Go that way, okay. If at any point you feel pain, please let me know. We're gonna do forward flexion, okay, hyperextension, okay, and back to the middle, and then we're gonna do abduction, okay, then external rotation, internal rotation, put the arms like that, and we do adduction. Do you have any pain doing that?
No.
All right, wonderful. And now we're gonna do with your arms, you're gonna do extension, pronation, supination, flexion, and extension. Any pain?
No.
Okay, now we're going to our wrists, our hands. So we're gonna do hyperextension, palmar flexion, back to the middle, radial deviation, ulnar deviation. Adduction is your fingers, make a fist, and finger to thumb. Okay, do you feel any pain doing that?
No.
Okay, my patient was able to perform a full range of motions in the shoulders, arms, and wrists without any discomfort, and the fingers were able to do resistance with the thumb without any discomfort. Now I need that you squeeze my fingers as hard as you can. Great, wonderful. Now you're gonna put your arms like that. I'm gonna pull and not create resistance. I'm gonna push and you're gonna create resistance, okay? Pull, okay, and I'm gonna push. All right, wonderful. My patient has a strength of 5 and a 5 scale and against resistance. Okay, need you please sit down and lay down in the bed for me, please. Okay. Have you ever suffered any constipation or diarrhea in the previous 2 months?
No.
None at all? Okay, I need that you put your hands close to body. Thank you. I'm gonna inspect your abdomen. Based on what I see, the abdomen is flat. There is no signs of hernias, any distensions, any pulsations, no signs of old scars or striations or lesions, no redness or swellings in the area. And I'm gonna auscultate, okay? Okay, we start for the lower right quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, all vowel sounds are present in all four quadrants. We know manifestations, herds, or any roots. I'm going to percuss. Okay, the abdomen is tympanic. I'm gonna apply light touch. Okay, and if you feel any pain, let me know. Okay?
No.
All right, the patient experienced no tenderness. I'm gonna be a little bit deeper. Okay, there's no lumps or masses that were palpable. Okay, I'm gonna go ahead and inspect for your legs. Okay, my patient has equal in size and symmetrical legs. There is no signs or swelling or redness. I'm gonna go ahead and check for venous powder. No signs of venous patterns present. No fighting edema or liquid retention notice. They're both equals in size. Both sides. I'm gonna go ahead and touch yours. Okay. They're warm up touch, equal temperature, and throughout the whole lower extremity. And again, no signs of lesions, deformities, masses, lumps, or scars from previous accidents. Have you ever suffered any fracture in the upper extremity? No ankles or knee involved? No? Okay, wonderful. We're gonna do the same test that we did in the upper extremity. Okay, I need to identify if it's sharp or dull. Okay, and you please close your eye.
Sharp. Dull. Dull. Sharp. Sharp. Dull.
Okay, and we're gonna do the same thing with light touch. Okay, close your eyes for me. Okay.
Yes. 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 Yes.
Okay. My patient was able to identify the sharp and dull and light up touch. What that means that the pain sensation is intact. I need that you move your leg away from your body. And again, this is adduction and adduction, abduction, and then adduction. Okay, I need that you bend your knees to your chest. All right, put it back again. Flexion and extension. Okay, great. Now we're gonna do with your feet. I need that you do plantar flexion, dorsiflexion, inversion, eversion. And I need that your fingers do this, your toes, sorry. All right, wonderful. Any pain doing that?
No.
Okay. My patient has a full range of motion without discomfort or pain, and the toes are able to adduct and shrink back again without any pain. I'm gonna go ahead and check for your pulsations. Okay. Posterior tibial pulse, it's 2+ on a 4-point scale. And I do dorsalis pedis pulse, and it's 2+ on a 4-point scale. Okay. And lastly, I need that you sit down for me, please. Okay, put your shoes on. Thank you. Have you ever had any seizures or passed out or
No.
loss of consciousness? Okay, wonderful. It's a good sign. I need that you please walk towards me for me, please. Okay, you can stop. Thank you. So the patient was able to walk well coordinated, There is no sign of discomfort or swelling, and the gait was steady. I need you go back, but walking from heel to toe for me, please. Great. The balance of the patient is properly and expected. No swelling, and again the gait is steady. The spine, it was in the midline. No signs of scoliosis when she was walking back then. Okay, now I'm gonna perform 2 tests. Okay. The first one is I need that you touch your nose as fast as you can and touch my finger, okay? Wonderful. And also I'm gonna need that you step your palms like that as fast as you can. Okay, you can stop. All right. A patient was able to do well-coordinated movements without any discomfort and without involuntary or rare movements. Okay. Now I need that you stay there. Close your eyes for 15 seconds. Okay. We're doing the rumbar test, and we expect the patient to stay there without swaying for 15 seconds. Okay, you can open your eyes. Wonderful. Patient was able to maintain her position steady without any signs of imbalance. And lastly, I need that you do the movements that I'm gonna do. We're gonna do forward flexion, okay, hyperextension of the spine, left side, right side. Okay, do you feel anything? Okay, you can please sit down where patient was able to do full run of motions of the spine without any discomfort or pain. Is there anything else I can do before I leave?
No.
You have any questions?
No.
Okay, it was my pleasure to serve you today. We'll see you in the next round.
Thank you.
you.